My name is Ajisekola Tobi Zaccheaus. I'm a student of Savonia University of Applied Science. My thesis topic is exploring the mental effect of nurse burnout on patient safety, and my group is TNE22SP. Before I go further, I would like to talk about some keywords in my thesis topic, which includes mental effect, mental, nurses and nursing, burnout, and patient safety. So let's start by defining what is burnout. According to Mashlak and Jackson, they define burnout as an occupational syndrome marked by emotional exhaustion, depolarization, and reduced personal accomplishment that result from chronic workplace stress. That is the definition of burnout. So going further, I would like to define what nursing is. According to Virginia Anderson, nursing can be defined as the act of assisting individual, either sick or well, in the performance of those activities contributing to their health and recovery, which they could have done either unaided if they have enough will and strength to perform those activities. And who are nurses? Nurses are people that have gone to study nursing in an accredited institution. So that's nurses. And what is mental? Mental is synonymous to psychology. So the effect, the impact is what is also known as mental effect. And what is patient safety? Patient safety is anything that reduces the harm or risk of on patients. So my thesis aims at research. My aim is to explore how the mental effect of nurse burnout affects patient safety, and the research question is how do mental effect of nurse burnout impact patient safety? So the methodology of my of this thesis, I use narrative literature review, which the study that I choose to is from 2015 2025, and I after the screening I was able to come up with 10 final studies, which the studies uses mixed systemic review, which uses systemic review, meta-analysis, and quantitative studies. So I use inductive thematic analysis to extract a theme on mental effect on patient safety. So, what are the mental effects that it could, a mental effect of burnout on nurses? It will cause emotional exhaustions, detachment and depolarization, impair cognitive abilities, decline in communication and empathy, and fatigue and lack of focus. What are the direct impacts on patient safety if a nurse is having the mental effect of burnout? It will increase medication error, increase the risk of patient falling, higher rate of hospital-acquired infection, which is also known as nosocomial infection, reduce quality of care and patient satisfactions, and worsen clinical outcomes. So, what are the recommendations we could give to to help this situation? Nurses and nursing students should be educated on and go for training on what burnout is, organization changes, intervention and support, and further research should be done. So, what are the implications for practice and education? So, nurse well-being is integral to patient safety. Preventing burnout protects patients and improve outcome. Early education on mental health, coping skills building lasting resilience and support safer clinical practice. And systemic solution which include staffing, leadership support, work design are essential. Individual strategy alone is not sufficient to help out on burnout, so it needs a collaborative effort. And in my final words, or as a concluding statement, I would like to say protect nurses' mental health to protect patients. Reducing burnout, reduce error, reduce infections, and reduce fall, reduce and it improves the quality of patient care. Thank you.